Hi everyone, Dr. Brandon Rosi here again with Rosi Physiotherapy. Again, it's still October, National Physical Therapy Month, so reading through the comments, and we had a comment from Jad. And so what Jad did is he sent me a message, said that he hyperextended his middle finger during jiu-jitsu about a month ago. His grip has suffered a little bit of a loss, but now he's currently at about 95% capacity, which is definitely a really good thing. He's getting better. He's getting stronger. He still says that in the morning he wakes up and it's kind of stiff. And after about 10 to 15 minutes of warming it up, it does get better, but he can't make a fist immediately, and it's kind of worrisome. So what we're going to do is we're going to talk about the wrist and the finger complex specifically, and about what a PT can do with the wrist. Again, I'm going to use the program Complete Anatomy to help kind of give this discussion. And let's do this. We're just going to drop it down and show you just kind of the right arm to kind of help make this discussion a little bit quicker and easier to see. So here it is. This is the ulna bone over here, which is kind of the weight-bearing bone of the elbow. And then here's the radius, which is kind of the weight-bearing bone of the wrist. As you can see, it gets much wider on the wrist than it does when it connects to the humerus up top, which is this bone here. Again, it doesn't really matter for the length of this conversation. So what is going on? And so again, so I'll kind of repeat. He said that he hyperextended his middle finger doing jiu-jitsu. And so what that kind of looks like is, let me see if I can get it in the finger. So here, the middle finger, the one with the ring on, and he hyperextended it so it went back. And now he's probably feeling some pain right along in this area right here. And then he's having problems when he wants to make wrong way. And he wants to make a fist, and he's probably feeling pain right in here in the middle of the palm, and maybe actually down here into the wrist. So the reason we're talking about the wrist is because, and I'm going to show you here in a minute, is even though the muscles that move our fingers around are actually, there's not very many muscle bellies, or the red meat muscles that you would kind of see in this picture. There's not very many muscle bellies in the hand itself, in the wrist. They're actually way down here in the wrist, in the forearm, and then they have nice tendinous, long, strong tendinous attachments that allow us to move the tiny bones in our hands and our fingers to make a fist. So what we're going to do is we're going to start by adding again some little bit of connective tissue to kind of just give it a real appearance, and then I'm going to add in some layers again. So here's some very deep muscles. They're called the interossea muscles that help us kind of flex and stabilize our hand, go like this, but that's really about it. And then here's some stabilizing muscles, and the reason I'm actually showing you this, we're not going to talk about them, it's just way too in-depth for the scope of this conversation. I just want to kind of show how when I put all these extra layers of connective tissue in, and how we're adding, actually that one's too far, how each muscle that we add is going to make a new layer and a new layer. So again, more deep muscles of the forearm, and they keep getting added, and then boom, and then there we are with the full muscles of the forearm. And so what we're actually going to do is we're going to cut back a little bit until we get to these guys right here. And so what this, the one I want to focus on, I'm going to highlight it, but you see these kind of tendinous strands, these 4 of them right here. And this muscle is called the flexor digitorum profundus, and it is a very, very deep muscle. And these tendons actually go all the way down, and they attach all the way down to the furthest, smallest point of the bone at the top, which is the ones that allow us to, kind of do this. So it kind of gives us that terminal flexion, which allows us to make a very, very tight fist. And so when he says that he's having problems making a fist, that's the first thing I think of, is that these tendons, the flexor digitorum profundus, is, again, that was highlighted, is the ones that are giving him pain. But the reason I want to kind of go a little more in depth, and we want to add one more layer, is because we're going to add a muscle right over top of it. It lays literally right on top, and it is called the flexor digitorum superficialis. So, and as you'll see here, so I just laid that on there. You probably didn't notice it. And so right here, and I'm going to zoom in because so it essentially has the same muscle action, but these tendons don't go as deep. So we have this called distal phalanx or the phalange, which distal meaning the furthest from the body, and then you have the middle and you have the proximal, which means it's closer to the body. And so this superficialis muscle actually originates or inserts onto the middle phalanx and the phalange, and that's why. So the profundus or the superficialis rather is actually, it doesn't go as deep or as far as the profundus, which is why. So if you want to talk which one is probably giving you the stronger flexion, so they both are going to allow you to make a fist, but if you're going to talk about which one makes you a stronger fist, it's most likely going to be the profundus. However, they both play a vital role in it, and as we get to the edge, we're going to zoom in here. So again, here's the superficialis tendon right on top, and as you can see, it splits and it kind of breaks away, and the profundus just literally slides right on through between the two of them. And so the reason, again, we talked about that is because of his pain. He says his pain is at the proximal joint, which is right here, which is literally on the kind of your knuckles, or you think where you'd get callus. If you're an avid weightlifter, where you get calluses a lot, that would be the proximal joint line. Or also, on the other side, think that's where your knuckles are. So, if his pain's here, it very well could be that, he has some sort of pain here and he's just feeling it there. Although since the hand is pretty discriminatory towards pain, it most likely is just a hyperextension of the joint itself. And so again, I just wanted to kind of show you that. And what I want to add in here is the blood supply, just like I've been adding with pretty much everything else, just to kind of give a reference point. So the reason I keep showing the blood supply is the blood is what is allowing us to recover, regenerate. And so we always want good, clean blood to go to the issue of trauma or damage to help curate that issue. And so we do have a pretty good flow with the palmar arch artery, which is way up here. Which is way up top here, and then we have what is called the digital branches, which is just going off to the digits right here. Now technically they do kind of go along the outer edges, and so as you can see, there's nothing too terribly close right to the tendon itself, which is why he says that he feel like he's getting stronger, but he's not 100% yet. Most likely he's resulted in and Jad specifically, you most likely have resulted in a some form of grade 1 or 2 tear, and that does not mean that you need surgery or anything like that. But most likely you have some sort of a tear and tendinopathy and a hyperextension injury from that, and that the reason you're feeling that pain and stiffness is because tendons just don't heal as quick. Tendons heal significantly slower than muscle bellies because, again, look at all this blood supply and how it's consistent with the muscle belly. Again, our body is kind of designed in a way to protect the muscles, and that's why you're able to make a fist, and after a while, once you warm it up, and that's because once this hand is full with enough blood, essentially that blood is just going to kind of gorge over and just bathe that tendon well enough to start healing it. And that reason you're feeling that relief after a couple minutes warming it up is simply because you're now pushing blood over into that tendinous area, and you're allowing it to regenerate and reheal itself. So actually, again, because you're 95% healed at this time, really I don't want to caution you into too much. What I would say is one thing I would avoid, especially with Brazilian jiu-jitsu, whether you do BJJ or just jiu-jitsu in itself, one thing I would mention is that pull-ups or push-ups and bear crawls are very common in that sport, especially as far as a warm-up, and I would avoid that at least for the next probably 2 weeks. And the reason being is because anytime you're doing a pull-up, again, I want to kind of get my hand in there, you don't want to have your hand hyperextended, or most importantly, when your hand is like this, even if you're up on your fingers, you don't really want to have that kind of stress going right into the palmar arch of the hand to protect that hand, because then it's just putting more stress into the hand. So if you are going to do push-ups, which if at all costs you could avoid for the next week or two, I would. But if you are going to do push-ups, I would kind of recommend you kind of make a mini fist like this, like a claw hand, not like this, but a claw hand, and then that way it kind of takes away that transverse arch of the palmar arch in the hand, and then you'll be able to kind of take a little bit of pressure off for the short term, and then hopefully you'll get some pain relief pretty quick from here. One other thing I wanted to touch on that is you kind of touched it with the nails. Once you warm up your hand, you're starting to feel better. So the one thing I would recommend for you to do is you definitely want to heat up that hand. You don't want to cool it down. You don't want to put on ice. I highly recommend you use heat, because it's definitely, we want to put heat, we want to put it in that area. Even though it's still kind of warm back in Ohio, it's getting cool out. Wear gloves, wear anything that really heat up your hands, get them, kind of sweaty. It'll definitely help, especially in the morning. If it's in the morning and you're not a morning person to shower in the morning, warm up. Definitely wash your hands with warm water. I'd say let it sit there for a good 2 to 3 minutes, and you'll definitely notice a valuable change. So, give that a shot and let us know. Again, if you have any questions, feel free to reach us out. Thank you for watching.